Anytime a baby is upset, it's tough for the parents to watch them suffer and cry, especially when they're inconsolable. So the heartache becomes even worse when the baby is diagnosed with infantile colic, because now they know the baby's going to be suffering for quite a while. I'm Dr. Rodney White with Sarpi Chiropractic, and today we're going to discuss what colic is, what theories abound about why it happens, and what some of the research is showing on certain things that you can do for it versus the research on current medications. So first of all, what is infantile colic? The medical diagnosis of infantile colic is given with the 3-3-3 rule. That means your baby's crying inconsolably for more than 3 hours a day, more than 3 days a week, for at least 3 weeks, the 3-3-3 rule. It affects about 40% of infants worldwide, peaks at 6 weeks, and usually fully self-resolves by 3 to 6 months. So long term, there's been no studies that have ever shown there's any lasting effects from it, but 3 to 6 months of watching your newborn cry in pain when there's nothing you can do about it can be very tough. It often causes physical and emotional stress for the parents and has actually been linked to marital and job disruptions and even child abuse. Now, not that we would condone any of those things, but it's amazing what stress can do to someone's mindset and the way they act. Possibly the most frustrating thing of all, though, is we really don't know the true cause. There's been a lot of studies done to try and find out what it is, and there's a number of hypotheses that exist, including, is there an alteration in the microflora in the gut and in the intestines? Is there lactose intolerance? They have shown some increase in colic with maternal smoking, but there's a lot of other things that would be an issue with maternal smoking. Possibly poor feeding techniques, but again, no research has ever been able to say that definitively. What's more likely is there's probably a whole combination of a bunch of those things. Another frustrating piece is that most medical interventions are generally ineffective and definitely come with side effect. So right now, the current medical options are really one of two things. There's either different medications, and like I just said, all the current systematic reviews of the literature have basically said that the medications used can't beat placebo. So if there's even a little side effect, then you can't really justify giving something that has more side effect than benefit. And if the benefit is only placebo, meaning the group of infants getting the medication versus a group of infants getting the sugar pill or the control group get the same result, the medication's not working. The sham group has to get less result than the medical group for that to work. So this means if drugs are prescribed for colic, there's poor, if any, evidence that it will even work. So now what all the good pediatricians out there are tending towards is, instead of the medication, they're giving parental advice and reassurance that the baby is going to grow out of it. And it's a benign issue, and they're right. But again, like we said at the start, that's tough. You can't just tell that to a parent when their child is suffering. Outside of drugs, what else could be done? There is some small literature growing that shows probiotics are probably helpful in breastfed babies. They have not yet shown really any benefit in formula-fed babies, but there's probably a lot of reasons behind that, and it's worth at least trying probiotics if your child is suffering, whether they're breastfed or bottle-fed, because it's not going to hurt them. Unlike a drug with a side effect, probiotics are only really going to help. So if that answer is not a good enough solution for parents, that you can either try drugs, probiotics, or we just reassure you, well, what do? They start turning to alternative options like chiropractic. Now, there's a lot of people out there, possibly some of you watching this, who might think that chiropractic is a scam, that is dangerous, that kids and babies should not get adjusted at all, and everyone is entitled to their opinion. But the good news for those of you who are looking for other options, there is a very robust and growing body of literature that says chiropractic can in fact help. So let's look at what some of the current research is. First of all, research starts with what happens in the clinics of doctors all around the country. Then they do case studies, and then that builds up to case series and survey studies and clinical trials. And then we get all the way up to the gold standard of the double-blinded randomized control trial. So let's look at a few different things that are out there for chiropractic and colic, and let's also look at a study that's often misinterpreted where people think it means it won't help at all. So a 2011 article in the journal Explore by Dr. Joel Alcantara reviewed all the literature they could find at the time with chiropractic and colic. They actually reviewed 26 different pieces of literature, clinical trials, case reports, cohort studies, a whole range of things. And from these 26 articles, they were conclusively able to conclude that chiropractic is both safe and effective for treating infantile colic. They did acknowledge that some of the research had some design flaws, like all research does, but they were very strong in their recommendation at the end of it. Then a Cochrane review was performed in 2012 to look further into this. Basically, they looked at spinal manipulative therapy and colic. Cochrane reviews are widely considered the gold standard of systematic reviews, but they are notorious for excluding anything except randomized control studies because they are very, very worried about any kind of perceived bias or placebo effects, which makes sense when we're dealing with pain because people, it's been shown, can imagine their symptoms getting better just with their mind. When we're observing something more objective, like how long a baby is crying, however, that doesn't seem to play as much of a role. Nevertheless, Cochrane review is very, very strict on that. So they identified 6 studies that originally met their criteria. 5 of those suggested that not only would manipulative therapy be beneficial for infantile colic and very safe, they found that the combination of all 6 studies showed an average decreased crying time for these babies of 1 hour and 12 minutes every day. Almost an hour and a quarter less a day of crying is huge for parents whose kids are suffering. These results were sustained when they removed all of the parental bias studies, but basically what we call getting rid of the placebo effect. But by removing these, we only got down to 35 minutes less crying time. And so then they decided that wasn't statistically significant. So the naysayers of chiropractic often tout this review as saying, see, chiropractic doesn't work, but that's not what they said at all. The reviewers actually said, we can't make a conclusive opinion one way or another, and they never mentioned anything about it being dangerous. An absence of evidence does not mean an evidence of absence. So, thankfully in the chiropractic world, someone said, okay, let's do some better randomized control studies. So the Journal of Manipulative Physiological Therapy, the JMPT in 2012, with a study by Miller et al., and we'll include that in the transcript, decided to do a proper randomized control trial. So at a teaching clinic in the UK, they had 104 babies present who were 8 weeks or younger, and they presented randomly to 3 groups. The first group got chiropractic treatment and the parents knew about it. The second group got chiropractic treatment and the parents didn't know if they were getting treatment or they were in the sham treatment or the control group. And the third group was the control group, but again, the parents didn't know. So they weren't sure if their child got real treatment or sham treatment. The babies were adjusted daily for only a 10-day span, and a crying journal was completed, and the results were absolutely amazing. Both the 2 chiropractic groups, the group 1 where parents knew and group 2 where parents didn't know what treatment they were getting, showed up to 3 hours less crying per day, and 10 days after the care was finished, they still averaged 2 hours a day less. This is a giant improvement for parents who are massively frazzled and stressed. That's huge, but the most important factor of this is that both groups improved equally regardless of whether parents knew or not. So this really confirms and strengthens all of the studies that the Cochrane review left out because they were so worried about parental bias. That is massive. For those parents whose children have colic, there's more and more studies like this being done that shows chiropractic probably can help. This study also showed that if your baby received chiropractic care, they were 12 times as likely to cry significantly less than if they didn't get it. And ultimately, the babies adjusted had a 50% less crying time than the babies who weren't adjusted. So you could potentially get half your baby's crying time under control just with chiropractic for colic. And again, we say potentially, we need to see more and more research, but it is being shown to be safe and effective. Now, every study has some strengths and limitations. The strength here, it's a double-blinded randomized control trial. Limitations, they were discharged after 10 days and nothing else was kept, so there could be relapses. Maybe chiropractic only works more in the short term. We need to know more. We know what we see in clinics, but we need to see more. Another limitation was that the treatments were done by chiropractic students. So imagine what result you can get in the real world with experienced, pediatrically trained chiropractors. It could be huge. So what does this mean for you, the listener? This study suggests that it is very, very likely that chiropractic care will help babies suffering with infantile colic. It doesn't cure it. That's not what we're trying to do at all, but by improving function of the nervous system, it appears very likely that a lot of their issues will calm down and the crying time may decrease by up to half. So if you're a parent whose child is suffering from colic, please don't hesitate to get your child checked by a chiropractor, preferably one that's had some extensive pediatric training, because it is different to working with adults. And this might make a huge difference to not only your child, but your entire family. And it is continuously being proven to be a safe and effective option.